你好啊，林太。香港民意研究所咧，尋日就公布咗一個民調結果啦。咁72%嘅受訪市民就話唔滿意港府嘅表現。見到咁多人唔滿意香港政府嘅表現啦，你有咩感受？其實你覺得港府喺邊方面嘅施政係最有改善空間呢？另外，其實港大啱有研究發現啦，香港嘅自殺個案喺3月23號就達到高峰，而長者嘅自殺率咧係屬於各個年齡層嘅最多嘅。咁有學者就促請政府應該盡快去重啟一啲康文設施啦。對於呢個自殺率嘅攀升，你又覺得點樣呢？會唔會覺得其實政府喺制定呢個抗疫政策嘅時候，過分側重抗疫而忽略咗市民嘅精神健康呢？唔該。
第一呢，就係香港係一個自由多元嘅社會嚇。每一個機構、每一位人呢，都可以自由咁評論所有嘅事，包括特區政府嘅工作同埋表現啊。我哋會以開放嘅態度啦、謙虛嘅立場啦，嚟到去聆聽各方嘅意見，從而改善我哋嘅方方面面嘅工作啊。但係本屆嘅特區政府喺接近5年期間呢，事實係做咗大量嘅工作嚇。喺舊年發表2021年施政報告呢，我已經做咗一個總篇，係匯報咗我哋喺呢一屆政府嘅各方面嘅工作。但係有好多工作係要持續努力先見到成效嘅嚇。同樣地喺抗擊疫情嗰度我哋由2020年1月開始，頭嗰2年呢，我哋都係相對成功。好多海外嘅機構都係反映話香港係好成功嚇。咁但係遇着呢個第5波嘅疫情，尤其是 Omicron 呢個變異病毒株傳播咁犀利嚇，再加上一啲嘅客觀環境嘅因素咧，今波疫情咧係真係好急好慢啊！但係我哋都從不鬆懈，我哋由1月開始已經係用到最嚴厲嘅外防輸入、內防擴散嘅措施。我哋不斷係呼籲市民市民亦都相對係配合呢啲嘅措施。當我哋見到自己嘅能力難以應變嘅時候咧，我哋亦都係馬上向中央尋求援助。中央亦都係即時為我哋提供好多方面嘅援助啊！咁所以我係已經係盡咗最大嘅努力嚇。但係你話可唔可以改善？我哋每一日都檢視我哋嘅工作從而可以改善。我每日喺度同大家做新聞發佈會，都好樂意聽到大家認為我哋喺邊啲地方有改善嘅工作啊。但係如果要市民有嗰個信心同埋保持嗰個精神嘅健康，其實係要社會有更加多嘅正能量。所以我留意到咧，就你頭先提到嗰個嘅研究或者調查咧，都希望大家發放一啲更加正面嘅信息啊。政府嘅官員亦都多表示對於市民嘅關懷，呢啲工作我哋都做緊。我亦都希望咧，全社會都係可以發放一啲正面嘅信息，可以齊心嚟到抗疫，可以幫我哋一齊做義工，去派發呢啲防疫嘅服務包，可以多打一啲電話俾鄰居或者親友，尤其是嗰啲喺檢疫或者隔離期間，睇下佢哋有啲咩需要。傳媒亦都可以多報導一啲好人好事啊！特別係我哋香港電台第32台啊，近日成為咗抗疫台咧，都係做咗好多好正面、好陽光嘅報導啊！呢啲將有助香港市民面對呢個逆境，從而提升翻佢哋嗰個抗疫嘅能力啦，亦都對香港繼續保持應該有嘅信心。
好，跟住係下一位記者嘅提問。我係有呢位女記者，唔該。
Good morning, Hong Kong Free Press. You said last week that the next administration can review the Omicron crisis, but many on your own side blame you for inaction. Last year, with among the highest death rate in the world and 7,000 dead. At the end of your tenure now, have you any regrets on COVID or things you would do differently? Thank you.
We are all saddened by the large number of fatalities in this epidemic, and that's why we are doing our utmost in order to safeguard the health and safety of the Hong Kong people. We have a long list of measures that we have introduced, we have improved, we have enhanced in order to safeguard the health and safety of the elderly people, and we will continue to do so. So this is at the moment one of our priorities, and we will continue to spare no effort in helping the elderly to save their lives.
Mr. Hoyd, this month a business chamber survey showed half of European firms are considering leaving next year. Unlike Singapore, we have no roadmap to normalcy. You know, what CEO is going to come in for a 7-day quarantine for a meeting or conference? Some say the adjustments to travel rules are too late to save the city's international status. What is your message to the businesses who are leaving?
Chris.
Thanks, CE. In response to the questions regarding what are the messages that we want to convey to the business community, I think there are two. Firstly, in light of this COVID situation, which is a global phenomenon, I think similar to every other jurisdiction, we are doing our part on various fronts to deal with it. And with response to many of the comments that have been made by the business, the comments that made by the sector, including the emphasis on connectivity, including the mainland and the rest of the world, the comments made regarding the schooling and also other aspects of the people's lives will be taken care of as we chart the way forward. That's number one. And number two, and the key message I want to convey is regarding Hong Kong being open to business. Because after all, if we look at the place where people or companies try to locate their business, definitely opportunities and talent are the key. And on that count, based on what I just introduced at the outset on the various measures we put forward to broaden the development scope of our sector, at the same time to nurture our talent pool, I think all these efforts will continue and also continue to be strengthened in such a way that Hong Kong will continue to open to business to the rest of the world.
On TCM, yesterday you said the use of Chinese medicine in curing infected COVID-19 patients has proven to be very effective on the mainland. Can you share which medicines you're referring to there? And in terms of sending out TCM to particularly older residents, do you think there is a fear of disincentivizing them to get vaccinated if they prefer TCM?
Now, about the use of traditional Chinese medicine, this is not something new in Hong Kong. Being a predominantly Chinese community, many of us actually use Chinese medicine at various stages of keeping ourselves healthy or for rehabilitation purpose. But in tackling COVID-19, because our focus is now on preventing critical illness and preventing deaths. So as I have just mentioned, in our public hospital system, so far, is mainly the mainstream is Western medicine. We don't even have one single Chinese medicine hospital. We are building one in Jiangguangou, but we did not have. There is a certain degree of application of Chinese medicine on a very small scale in our public hospitals. But the fact is, the development of Chinese medicine in Hong Kong has been constrained by many factors because of the history. But it doesn't mean that it is not effective. Well, in the mainland of China, I was told by the experts, I read a lot of literature, then how they are able to cure critically ill COVID-19 patients. There was a figure given to me yesterday, but I couldn't recall it now, that many of the serious and critical cases in various provinces during the last 2 years of the epidemic have been treated effectively through application of Chinese medicine. And the experts that we have invited to Hong Kong will certainly give us good advice on this. We already have a 2 weeks experience of some Chinese medicine practitioners curing and looking after patients, especially elderly patients, at the Community Treatment Center at the Asia World Expo. Now, you asked specifically about our sending traditional Chinese medicine to all residents and whether this would disincentivize vaccination. The proprietary Chinese medicine tablets that we are sending in the anti-epidemic bag to all the households in Hong Kong are for treatment. It's just like Panadol or paracetamol. It's not for prevention, okay? So vaccination remains the most effective means to prevent an infected person becoming seriously or critically ill. There is no contradiction whatsoever between the two missions. One is to give Hong Kong residents some sort of safeguards. When they fall ill, they could have paracetamol, they could have this proprietary Chinese medicine to cure, especially if they have mild fever. Second mission is to continue to encourage vaccination, especially amongst the elderly and the young. And this is very welcome. I have to tell you that the proprietary Chinese medicine are very much welcome by the people of Hong Kong whenever we go out to distribute this supplies donated or given to us by the central government.